Good evening. Thank you so much for this wonderful introduction and for having me tonight. Thank you to everyone in attendance for joining me to discuss this very important topic. I would like to start by asking you a very important question. Women, do you know your risk for stroke? This is what I would like to discuss tonight. First, let's talk about stroke. Stroke is the number 5 cause of death and a leading cause of disability in the United States. Stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or ruptures. When that happens, part of the brain cannot get the blood and oxygen it needs, so brain cells die. How do strokes affect people? Well, the effects of a stroke depend on a lot of different things, including the part and how much of the brain is affected, and also how quickly the stroke is treated. Some people who have a stroke have mild symptoms, and some have no lasting effects. Others may lose important brain functions. Some people may become partially paralyzed or unable to speak. Now, how can you tell if someone is having a stroke? There's an easy way to remember the signs of a stroke. The symptoms usually come on suddenly. Just think of the term be fast. Each letter in the word stands for one of the things you should watch for and what to do about it. Be fast. B stands for balance. Is the person having trouble standing or walking? E stands for eyes. Is the person having trouble with their vision? And that could be blurred vision, vision loss from one eye, or missing parts of the vision. F stands for face. Does the person's face look uneven or droop on one side? You can try to carefully look at the person's face or ask them to smile and see if you notice if it is symmetric or not. A stands for arm. Does a person have weakness or numbness in one or both arms? You can ask the person to put both arms out and see if one arm drifts down. S stands for speech. Is the person having trouble speaking? Does his or her speech sound strange? And this could be slurred speech, also difficulties comprehending, or difficulties trying to convey their thoughts. And T stands for time. If you notice any of these stroke signs, call for an ambulance. So it's important to call 911 because you need to act fast. The sooner treatment begins, the better the chances of recovery. Now, let's discuss what is a TIA. TIA stands for transient ischemic attack. A TIA is similar to a stroke, but it doesn't damage the brain. It also happens when an artery in the brain gets blocked, but then reopens on its own. So for patients that have a TIA, they have symptoms that last for a short period of time, sometimes could be minutes or a few hours. But this is also a serious condition because if you have a TIA, you are at a high risk of having a stroke. So it's important to see a doctor and take steps to prevent that from happening. So it's important to don't ignore the symptoms of a stroke, even if they go away. Now, there are risk factors that have been associated with an increased risk for stroke. Some of these risk factors you can control, treat, and improve. One of the most important of those risk factors is high blood pressure. It is actually a leading cause of a stroke and the most significant controllable risk factor. Another important risk factor is smoking. The nicotine and carbon monoxide in cigarette smoke damage the blood vessels and the heart, and that increases the risk for stroke. Another risk factor is diabetes. So if you have type 1 or type 2 diabetes, it's important to control your blood sugar. Diabetes is a risk factor for a stroke by itself, but also patients that have diabetes have a high blood pressure or a tendency to have high blood pressure, high blood cholesterol, and are overweight. And that increases the risk for a stroke even more. Another important risk factor is the diet. So diets that are rich in cholesterol can increase the blood cholesterol levels. Those high in sodium or salt can increase blood pressure, and those with high calories can lead to obesity. On the other hand, a diet that contains 5 or more servings of fruits and vegetables per day may reduce the risk of a stroke. Another important risk factor is physical inactivity and also obesity. So physical inactivity can increase your risk of a stroke and heart disease, high blood pressure, high blood cholesterol, and diabetes. So it's important to aim for being active at least 150 minutes a week. But if you cannot do that, just move more and sit less. Another important risk factor is high blood cholesterol. There are other medical conditions that can increase the risk of a stroke, including the carotid artery disease. Carotid arteries are main blood vessels in the neck that bring the blood to the brain. As we age and we have other medical conditions such as high blood pressure, high cholesterol, diabetes, fatty deposits in the blood vessels, and that blood vessel can narrow, and also a blood clot can form in the blood vessel and can cause a stroke. Another important condition to discuss is peripheral artery disease. This is a narrowing of the blood vessels carrying blood to leg and arm muscles. It also is caused by fatty buildup of plaque in artery walls. And people who have peripheral artery disease have a higher risk of carotid artery disease, which raises their risk of a stroke. Another condition is called atrial fibrillation. This is very common as we age to develop atrial fibrillation. This is an irregular an irregular rhythm of the heart that predisposes to clot formation in the heart. That clot can break loose and travel to the brain and cause a stroke. So patients that have atrial fibrillation may need a specific medication to prevent a stroke, and this is most of the time a blood thinner medication. But sometimes patients that cannot take a blood thinner medication could be treated with aspirin to prevent a stroke. Other heart diseases have been associated with an increased risk of a stroke, including coronary heart disease, heart failure, an enlarged heart valve disease, and some congenital heart defects can also raise the risk of a stroke. There are other risk factors that unfortunately are not within your control, and the most important one is age. The likelihood of having a stroke increases with age for both males and females. Although stroke is more common among the elderly, a lot of people under 65 also have strokes. Another risk factor is family history. If your parent, grandparent, sister, or brother has had a stroke, especially before reaching age 65, you may be at greater risk. Sometimes strokes are caused by genetic disorders, which can block blood flow in the brain. Another risk factor is race. African Americans have a much higher risk of death from a stroke than Caucasians do. This is partly because Black people have higher risk of high blood pressure, diabetes, and obesity. Also, gender is a risk factor. Women have more strokes than men, and a stroke kills more women than men. Having had a prior stroke, TIA, or heart attack also increases the risk of having another stroke. So someone that have had a prior stroke has a much higher risk of having another stroke than a person who has never had one. A person who has had one or more transient ischemic attacks, or TIA, is almost 10 times more likely to have a stroke than someone of the same age and sex who hasn't. There are additional factors that may be linked to higher stroke risks. Unfortunately, for the last few years, we have seen an increase in blood clot formation as a complication of COVID that can result in stroke. Also, geographic location has been associated with an increased risk for stroke. Strokes are more common in southeastern states. That area is known as the stroke belt. Socioeconomic factors have also been linked to strokes. Strokes may be more common among those with lower incomes. One reason may be due to higher smoking and obesity rates, and another reason may be that access to quality health care is often more limited among those with lower incomes. Also, the use of drugs, including alcohol or other drugs such as cocaine, amphetamines, and heroin, have been associated with an increased risk of a stroke. There is another medical condition that is called sleep apnea that has been related to a stroke. Patients that have sleep apnea are advised to use their CPAP machine regularly to decrease the risk of a stroke. Now, so far we have discussed the risk factors and the most common stroke symptoms. Now, I would like to discuss specific aspects of a stroke in women. In the United States, we see differences in gender. For example, the prevalence of a stroke is similar between men and women from 20 to 59 years of age, but is higher in men between 60 and 79 years of age, and higher in women older than 80 years of age. Women can have more severe strokes. Actually, stroke is the number 4 cause of death in women. The worst outcome is a result of older age at the time of a stroke onset, worse pre-stroke functional status, and multiple comorbidities, including high blood pressure and atrial fibrillation. The probability of death in the first year after stroke in men and women differs widely by age and ethnicity, and it reaches 36% in white women older than 75 years of age, followed by white men, Black women 27%, and Black men 25%. The higher stroke risk in women may be due to age, given overall a longer lifespan, other comorbidities such as atrial fibrillation, which increases stroke risk among women over age 75 by 20%. Also, hormone replacement therapy could increase the risk for a stroke, and it's important to note that it should never be used to prevent stroke in postmenopausal women. There are other conditions that have been associated with a stroke in women at a younger age, including pregnancy. The risk of a stroke in pregnant women is 21 per 100,000, with the highest stroke risk during the end of pregnancy and after delivery. So those with a high blood pressure should be treated with medications and monitored closely. There is another condition named preeclampsia. This is high blood pressure that develops during pregnancy. So if you have any history of hypertension, talk to your healthcare provider about taking a low dose of aspirin starting in the second trimester of the pregnancy. Another important risk factor for women at young age is birth control pills. Birth control pills have become much safer over time, but women who are already at risk of a stroke should take extra precautions. So it's important to get a screen for high blood pressure before the pill is prescribed. And never smoke while taking oral contraceptives. Smokers with migraines accompanied by aura should quit immediately. Now, it's important also to know that women may report symptoms of a stroke that are different from the common symptoms. And they can include loss of consciousness or fainting, general weakness, confusion, unresponsiveness, or disorientation. Also, some behavioral changes, including agitation, hallucinations, and even seizures. Now, how can we treat strokes? Well, the right treatment depends on what kind of a stroke you're having. That's why it's very important to get to the hospital very quickly to figure this out. The patients whose strokes are caused by blocked arteries can get treatments that help reopen the blocked artery. It could be with medications that are given in the vein and with catheter procedures. This treatment can help you recover from the stroke. After a TIA or a stroke happens, some medicines can be given to prevent new blood clots. And these medicines also help prevent future strokes. For the people whose strokes are caused by bleeding, they can have treatments that might reduce the damage caused by bleeding in or around the brain. Sometimes it's important to stop taking medicines that can increase bleeding or take a lower dose. And in some situations, there are surgeries or procedures that can be done to treat the blood vessel and prevent more bleeding. What else can we do to prevent a stroke? So many strokes can be prevented, and you can greatly lower your chance of having a stroke by taking the prescribed medicines and lifestyle changes. Medicine and lifestyle changes work together to give the most benefit. Some of these medicines work by lowering your risk factors, and this is going to include medicines to lower the blood pressure, medicines to lower the bad cholesterol, such as statins, medicine that help to keep your blood sugar as close to normal as possible if you have diabetes, and medicines to prevent blood clots, such as aspirin or blood thinners. It's important that whatever medicines your doctor prescribes, you make sure you take them every day as directed. If you cannot afford your medicines or if they cause side effects, please talk to your doctor or nurse. There are often ways to deal with these problems. So remember, it's just as important to make the lifestyle changes and also to take the medicines. Now, let's talk about the lifestyle changes. They can do a lot to lower your risk of a stroke. That is partly because the right lifestyle choices can help control risk factors, such as blood pressure, blood sugar, and cholesterol. So, stop smoking if you smoke. Get regular exercise if your doctor says it's safe for at least 30 minutes a day on most days of the week. Lose weight if you are overweight. Eat a Mediterranean diet rich in fruits, vegetables, and low-fat dairy products, and low in meats sweet and refined grains, such as white bread or white rice. Eat less salt or sodium, and limit the amount of alcohol you drink. For a woman, do not drink more than 1 drink a day, and for men, do not drink more than 2 drinks a day. So it's important to keep in mind that we can try to make all these lifestyle changes and take the medications prescribed by your provider to try to decrease the risk of a stroke. A stroke could be a devastating disease. Nowadays, we have great tools to prevent and to treat strokes. That is why it's very important to increase stroke awareness in our community to achieve the best possible outcome. Thank you so much for your kind listening. I would be happy to take any questions that anyone may have now.
Thank you, Dr. Flores. That was great. And I love your roses at the end. Very nice.
Thank you.
Matches your blouse. Wonderful. And we do have, it looks like we have some questions coming from the audience. And I just want to remind everyone that that's in attendance that if you have any questions for Dr. Flores, you can type them in the Q&A box, and we'll try to get all of them before the end of the program. The first one is from Carol Lee, and she would like to know, when is a PFO closed to prevent a stroke? And she doesn't specify what the PFO is.
Yeah, so that's a very good question and a very, very specific question. So a PFO is called patent foramen ovale. That is a communication between the right side of the heart and the left side of the heart. Actually, we all are born with that communication. For most of us, will close up, but for 25-30% of the population will still stay open. So PFO can be mainly related to a stroke in young patients. So how could a PFO be related to a stroke? So if someone has a clot in the legs, that clot can travel from the legs to the right side of the heart and then cross from the right side of the heart to the left side through the PFO or that communication, and then from the left side of the heart can travel to the brain and cause a blockage of a blood vessel, and that could result in stroke. So this happens, or we think that that could be the mechanism of a stroke in a very low percentage of patients. We mainly get concerned with that possibility for young patients, that when we do all the workup for a stroke, we don't find any other cause for a stroke, and we then find out that they have the PFO. For patients that have a PFO and stroke that we believe it could have been related to the PFO, then we as neurologists refer those patients to the cardiology team. And the cardiology team, most of the time, are going to get another echocardiogram that is an ultrasound of the heart. But this one is when the patients swallow the probe and they can get a better picture of the heart to confirm that actually the patient has a PFO, or that communication between the right and the left side of the heart. And depending on certain characteristics of the communication, if cardiology feels that patients are at high risk of another event, they may offer that intervention. So it's an intervention that is done through the blood vessels with a catheter. It's not an open surgery. It's done in just a few of all the stroke patients that we see. And those patients are going to have the treatment, and the risk of a stroke hopefully will decrease for them. Most of the time, even when the procedure is done, those patients will stay on aspirin for a long period of time, and most of the time lifelong. I hope that answers the question.
Yeah, it sounded great. The next question is from Catherine, and she'd like to know, can epilepsy create an increased risk of stroke? And can having palpitations or extra heartbeats increase risk of stroke?
Okay, thank you very much for the question. So we haven't really seen a relation between epilepsy and stroke. Not by itself, there are some conditions where patients can, mainly genetic conditions that are rare conditions where patients could have seizures and spells that are similar to stroke. But for patients that have the most frequent type of stroke of seizures, that could be mainly when they develop seizures at a young age, there shouldn't be an increased risk for a stroke. On the other hand, we see patients that have had stroke, and because they have a damage to a certain part of the brain, they could have an increased risk for seizures. Sometimes that happens soon after they have the stroke, and other times could happen years after the stroke. But there is no a good way that we can predict which patients could develop seizures after having a stroke. And the second question, remind me, Sue, what was the second part of the question?
Yeah, I'm sorry, I should have just done it separately. She'd like to know, and can having palpitations or extra heartbeats increase risk of stroke?
Okay, very good question. So palpitations sometimes is just a benign thing that sometimes we feel that the heart is racing, and sometimes it's not a malignant condition behind that. But other times, patient could have palpitations because of irregular rhythm of the heart. And the most concerning one would be the atrial fibrillation. That is the condition that is irregular rhythm of the heart, that patients could develop clots in the heart, and then unfortunately, that can result in a stroke. Unfortunately, it's frequent that patients that actually have atrial fibrillation, they don't feel the palpitations. But for patients who feel that they have some irregular rhythm, it's important to talk to the providers with the primary care doctors, because they can have different tests that are going to look for the heartbeat and try to see what is the cause of the palpitation. So that's something very important to discuss with a primary doctor, because if it's just a benign condition, like sometimes we have like racings of the heart and there is no atrial fibrillation or no other irregular rhythm of the heart, that wouldn't increase the risk of a stroke. But if that person is diagnosed with atrial fibrillation, this other irregular rhythm of the heart, then that will increase the risk for a stroke, and sometimes medications need to be given to decrease the risk for a stroke for that particular person.
Excellent, thank you. This attendee would like to know, can breast cancer treatments increase risk of stroke?
So that is a very important question, and there are multiple treatments that can be given for breast cancer. And even though I believe that would be perhaps a more specific question to the doctors that actually prescribe those medications, because sometimes we do have patients that have a breast cancer, are in a very specific medication, and then we need to talk to the oncologist doctor and try to see what they think about that particular medication, if it could be related to an increased risk for a stroke. But what I can say about the breast cancer is that cancer by itself, it has been associated with a higher risk for a stroke. And the cancer can cause the blood to be thicker than usual, and that can make the patients to have clots, not only in the brain, but also in other blood vessels. And the most frequent ones that we see with cancer is blood clots in the legs and also blood clots in the lungs. But yes, we can see patients that can have a stroke because of cancer itself.
Thank you. The next question is Linda. She'd like to know, is it safe to use low-dose aspirin if taking fish oil supplements?
So I'm not aware of any interaction between both of them. I always advise the patients to discuss with a primary doctor if they are going to take some natural like supplements, because sometimes there could be some specific interaction with other medications. And sometimes patients do have an indication for a more specific treatment instead of like some natural supplements. But as far as I know, shouldn't be any contraindication of taking both of them.
Excellent, thank you. Good to know. Jackie would like to know, if I don't drink or smoke, have good cholesterol, low blood pressure, not diabetic or overweight, how important is it for me to limit salt to intake? I am a potato chip freak.
Okay, that's a very good question. So I think that once in a while, perhaps we need to treat ourselves, right? And unfortunately, the very tasty things sometimes are not the healthier ones, right? But I think that overall is kind of a balance in life, right? There are some times where we cannot do like all the exercise that we want to do or eat all the healthy things that we want to eat. But overall, it's a balance. So I don't think that for doing once in a while, something like that will increase the risk for a stroke. But overall, a lifestyle that aims for having a healthy diet and regular exercises and taking good care of yourself, it's going to be important for the overall health.
Excellent, thank you. And I can understand why Jackie is a chip freak. Yvonne would like to know, and I hope I expressed this question correctly, what about taking statins? At what age? In quotes, she has, if mother had stroke in her 80s. So obviously she has some genetics there.
Okay, so the statin is a very specific medication that is used to decrease the cholesterol levels and also to decrease the cholesterol built up in the blood vessels. Me as a stroke doctor, we use the statin in almost every patient that we see with stroke, because most of the patients that we see are older patients that have some atherosclerosis or narrowing of the blood vessel caused by the cholesterol that deposits in the blood vessels. And that medication is going to be important to try to protect the blood vessels. The statins, there are different statins, there are different doses that can be used, and they can be a statin most of the time after a stroke when we see that the cholesterol is very high or we see narrowing of the blood vessels. But it's important to know that most of the time, even when the cholesterol has reached a normal level, we want to keep the medications on because we need to protect the blood vessels. So their effect is not only decreasing the level in the blood, but also protecting the blood vessels. And the dose is going to depend on the level of the cholesterol, is going to depend on the age, because we have seen that older patients perhaps will not be able to tolerate a higher dose. Sometimes patients could develop muscle pain that could at times in a minority of patients could be debilitating. So we have to decrease the dose, adjust the dose, and sometimes even try other medications in the same group of medications.
Thank you. Jennifer would like to know, how does an implanted loop recorder help prevent a stroke?
Okay. So that's a very important question, and that relates to the atrial fibrillation. So an implantable loop recorder, what it's trying to do is to capture the atrial fibrillation. So that irregular rhythm of the heart sometimes very difficult to diagnose because sometimes patients don't have any symptoms and it comes and goes. So the implantable loop recorder, what it does is it stays underneath the skin for a prolonged period of time, and it will record that information. So it's the sensitivity to try to capture the atrial fibrillation is high, and also the period of time that it can be in place, and the battery, it records for 2 or 3 years. So if the atrial fibrillation is present, we have a higher chance to capture the atrial fibrillation with that monitor. And if the atrial fibrillation is captured and we feel that that would be the cause of the stroke, then some medications, specific medications, are going to be offered. And most of the time for patients that don't have a contraindication, that medication is going to be a blood thinner medication. And that is a very important medication to prevent a stroke for patients that have had a TIA or a stroke, or are at a higher risk for having a TIA or a stroke and are diagnosed with an atrial fibrillation.
Excellent, thank you. The next attendee would like to know, can chronic poor sleep patterns increase risk of stroke?
It's a very nice question. So that will relate to perhaps patients that could have a sleep apnea. So sometimes patients have sleep problems, but they don't have a diagnosis of what is the specific sleep problem that they have. So I would advise the attendee and anyone that is dealing with sleep problems to try to talk to the primary doctor, and mainly for the patients that have snoring. And we are not aware if we snore, but like talking with the family and try to find out if snoring is something that is happening at night, if patients wake up tired, didn't have a restful sleep, or if they wake up in the middle of the night trying like gasping for air. Those things are going to perhaps indicate that the patient could have a sleep apnea. So for patients that have a sleep apnea, they have an increased risk for stroke and also for other conditions such as high blood pressure that could increase the risk of a stroke even more. So if there is some of these sleep conditions present for and would be the cause of having not a restful sleep at night, that could increase the risk for a stroke. And that it's important to have a diagnosis and a proper treatment, because patients that have a sleep apnea and are treated with the CPAP machine, they do really well. And they tend to decrease the blood pressure, sometimes even if they're overweight with the treatment of the sleep apnea. There is a relation between being overweight and sleep apnea in both directions. So patients that have a sleep apnea have a tendency to be overweight, and patients that are overweight could have an increased risk for a sleep apnea. So treating both of them is going to be beneficial, and definitely treating all these conditions is going to decrease the risk for a stroke and other heart conditions.
Wow, great to know. Jean would like to know, what happens if the stroke sufferer is alone when the stroke occurs? Is it possible for them to self-diagnose a stroke, or would the sufferer not be able to do so?
That's a very, very interesting question. So the symptoms that the stroke would present with depends on the part of the brain that is affected. Unfortunately, for patients that have a stroke in the right side of the brain, sometimes they're not even aware that something is wrong. Sometimes we see patients presenting with a profound weakness on the left side, because right side of the brain controls the motor function of the movements of the left side. So there's situations where we see patients that cannot move the left side or are very weak on the left side, and they're not even aware of the symptoms that they are having. So that could be very difficult to be at home alone and don't even recognize the symptoms. But the other thing that happens when patients are alone is that we don't know, sometimes it's very hard to know what time the symptoms may have occurred. So it's important when we see a stroke patients to know when was the last time that the patient was seen normal, because the treatments that we have, the acute treatments that we have for a stroke, they're time dependent. So we have a short period of time to offer those medications, and we need to know when the patient was doing as usual to try to estimate when the stroke symptoms could have happened. So for patients that are by themselves and they cannot communicate, because sometimes it's a speech problems what they have, or they cannot understand what we are asking them to do, or they cannot express themselves, it's going to be very difficult to know what was the last time that they were doing fine without any symptoms.
The next, it's a comment actually from Carol Lee. She just wanted to thank you for taking the time to explain stroke in women. So she
It's
says,
my
thank
pleasure.
you. Susan would like to know, what is the risk for women who have occasional oral migraines and take low dose HRT?
Okay. So that's a very good question. For patients that have migraine, that have aura, they have a increased risk for a stroke, but most of the time when there are other conditions associated to it or other risk factors. So mainly it's going to be the use of like the smoking, young women that have migraine, that they have aura and they smoke, or they use some contraceptive pills. So usually the other medication like the hormone replacement usually is a low dose of medication that are used for the treatment to try to help with the symptoms. But I would say that if the migraine is under good control and the medication is a low dose, most likely it's going to be a risk that perhaps is worth to take if it helps a lot with the symptoms. But I always recommend to talk to the primary doctor and make sure that they address all the other vascular risk factors the best possible way. Like make sure that the blood pressure is in good control, that they don't have like diabetes or is well treated. And if there is an increase of cholesterol, try to have a diet, and if they need medication, so try to take good care of themselves and try to decrease all the other risk factors to like overall have a better health.
Great advice. Thank you. Claire would like to know, can excessive pain cause a stroke?
Well, that's a very interesting question. And there are some conditions that perhaps I'm not sure about physical pain, but there are some conditions when we are going through emotional pain and something very difficult and tragic has happened in life, that sometimes the heart can suffer from that condition, and as a result of that, stroke could happen. So as a pain, like a physical pain, it's hard for me to come up with a theory that could cause a stroke. But for other more like emotional and being under a lot of other stressful situations, yes, we have seen, and it's a condition that could affect the heart and even cause like heart attacks and even as a complication, a stroke.
Is that what they call broken heart syndrome?
It is also, actually, I'm not sure about that term, but the medical term is called Takotsubo. Oh. And that is like it means the in the language that it was described, it means the shape of the heart, that because it's affected and it cannot like contract in the usual way, so it acquires like a dilated shape, and that's how they call this name. So it's a very interesting condition that we see at times, and patients sometimes like over time recover the function of the heart and they need treatment. But it could be as a scary condition as having a heart attack from the regular causes for heart attack as we age and have some narrowing of the blood vessels in the heart.
Sure. Fascinating. This attendee would like to know if someone they know is having a stroke, should I give them aspirin?
Very, very good question. So the most important thing is to recognize that the symptoms could be stroke related, okay? So we discussed that way, like be fast. If you notice any of those symptoms, then you need to be thinking that perhaps that person could have a stroke. The most important thing to do in that situation is to activate 911 and let them know what symptoms you are seeing in the person that you have with you. The problem with the stroke is that there are mainly two types of a stroke. One that is caused by a blockage of the blood vessels, and the other that is caused by a rupture of the blood vessel. And at the beginning, not even for us as a physician, we don't know which one of these two strokes the patient is having until we get a CAT scan. So that's why we rush the patients to the CAT scan as soon as they get to the hospital when they come with a stroke symptoms to try to see if the patient is having a bleed. Because for patients that have a bleed, they need different medications than the patients that have a blockage. So my recommendation is to not give aspirin to a person that may be having a stroke until the patient gets to the hospital and gets the proper treatment. But yes, aspirin is a very, very important medication. For patients that are having a stroke, that is because of a blockage of a blood vessel, that is a medication that we use. But first, we need to make sure that the patient doesn't have a bleed. And there are other medications that can be given when the patient is having a stroke because of a blockage of a blood vessel. If we think that the patient is a candidate to give the medication in the vein to try to open the blood vessel, we don't give aspirin for those patients right away. We give the medication in the vein, and then we have to wait 24 hours after that medication is given to be able to start the aspirin. So overall, my recommendation is don't give aspirin to a patient that seems that is suffering from a stroke. It's important to call 911 and get to the hospital because they need to have the specific treatment for that type of stroke.
Oh, thank you. Excellent information. Great question, too. The last two are just comments. Stephanie says, yes, thank you, Dr. Flores. You are amazing.
Oh, thank you.
And Linda said, thank you very much for the important information and answering questions. And with that, we'll end the program for tonight. And I thank you, Dr. Flores. Great presentation, and we appreciate your time.
Thank you. It was my pleasure. You have a good night.
Thank you. You too.